So, what is anxiety? So, a good place to start is how did the word come about? And like most words in our language, it come from the Latin "anger," which means torment. And that's probably a fitting word because when you speak to people with anxiety, especially people that have had anxiety for a long period of time, they will tell you that their symptoms have tormented them. Now, what's not uncommon with anxiety is when people start to discuss it, they will start to tell you about all the physiological symptoms they experience. For example, the changes in their heart rate, blood pressure, the way that they feel. Now, why that's not unusual is because it seems like language has accommodated for that or coded for that and give us an expressions to help better explain the physiological changes that occur with anxiety. For example, I had butterflies in my stomach. I felt that my heart was in my throat. I felt the heavy weight on my chest. I felt that my stomach was in my throat. So there is something about these physiological symptoms that we've been able to put into some form of language to help better express how we experience anxiety. Now, anxiety is just not about all the physiological symptoms, even though it's the most salient starting point for most people to talk about when they experience it, especially for people that have intense anxiety. Some of the other things that occur simultaneously with anxiety is a change in our emotions and our moods. For example, anxiety can lead to fear and dread. There's also a change in our cognitions. For example, some of the thoughts and beliefs that we're having. We can start to think that something bad is going to happen, have an image of it, and start to catastrophize. Now, one of the most common things that people undertake during an experience of anxiety is to worry. Now, worry is also one of the cardinal ingredients to generalized anxiety disorder. So, what worry is, it's a cognitive process of either thoughts or images that are associated usually with negatively balanced things that may occur in an attempt to form some form of plan to deal with it. And that makes great sense. But what we see in anxiety, and especially with people that have suffered with anxiety, is that the level of worry they engage in becomes so maladaptive to the point they can't disengage and they're constantly worrying, bringing themselves distress. And usually, that worry can start to think of other things to worry about. And a lot of people have probably entertained, why is it when I worry, things start to pop into my mind? That's because there is enough evidence to suggest that our imagination and anxiety somehow get together to create possible scenarios that may occur, even if the probability is low, that we start to give a lot of serious thought to. So we start to use our imagination in not a very positive way to start to think of other things that may never have occurred that could occur that start to give us concern because we've never experienced it before. Other things that occur with anxiety are the behavioral changes. One of the most common behavioral changes in anxiety is avoidance of threat. Now, it's probably good to take a step back here to say that our avoidance isn't usually a physical threat these days. It could be also of psychological threat. Things that we can find damaging to ourselves, like our self-esteem or the way we see ourselves or our reputation. So avoidance is one of the most common behaviors that we use to deal with anxiety. Other less subtle forms of anxiety could be to avoid our thoughts, to try to block them out, not pay them attention. Less subtle forms of anxiety could be what we call safety behaviors. We see this commonly in social anxiety disorder, where people will disengage from eye contact just so the other person can't get enough information to see if they're feeling anxious. Other behaviors can be biting of the nails, rocking back in chairs. It could also be the grinding of the teeth. And this is commonly seen in dentistry practices where the enamel's been removed from a chronic long-term grinding of the teeth, and pacing. What is interesting is that anxiety is not a unidimensional construct, and what makes it, as the Latin word anger for torment, what makes it so tormenting is that All these things, the physiological, the effect, the behavioral, and the cognitions, all come together simultaneously to make it a very uncomfortable, chronic, ongoing experience for the person.